If you or a loved one have dealt with gallbladder issues, you definitely know how painful those can get. It can even turn deadly if not properly treated. Joining us today is Dr. Will Cawthon to help us learn how to identify these issues. But one thing we've talked about is how common gallbladder problems actually are. How common is that?
Yeah, for sure. It's really common. It's one of the most common things we see in our practice. I probably see hundreds of patients a year, and it's year after year one of the most common procedures we do.
Yeah, and we talked right before this. You've done 7 surgeries. That's the most you've done in a day, right?
In one day. Yeah, I average about 200 a year, and I've done about 2,500 total since I've been here.
Wow. And when it comes to symptoms and people trying to figure out maybe this is the issue, what are symptoms of gallbladder issues?
Usually the most common thing we see is going to be upper abdominal pain. It's usually going to be on the right side. Sometimes it can be on the left, but usually on the right. And then people are usually have nausea, vomiting, sometimes diarrhea, sometimes early satiety, or they get full really fast.
Yeah.
But the most common thing we're usually looking for is pain.
And I guess on a scale of 1 to 10, how bad would that pain be?
It varies a lot. It can be mild. It usually presents after you eat a large meal, usually things that are greasy or fried, some of that favorite Mississippi food.
Yeah.
But it can be pretty severe.
And when it comes to treating that, what do you do?
Yeah, so the first thing we start with usually is diet modification. So we'll tell people, try to stay away from anything that's real greasy or fried, things that are baked or grilled. And that'll work for some people, but the majority of people end up having surgery to remove the gallbladder, and that usually fixes the problem.
And, post gallbladder surgery and maybe getting that removed, what does a lifestyle look like after that?
So typically people, go and have a normal life. I tell all my patients I don't put them in any restrictions, so they can do normal diet, normal activities. Some people will get diarrhea, but it's usually self-limited. And I always say, if it doesn't resolve, come see me back, and no one ever comes back.
Oh, okay, good. And gallbladder issues, who do they affect? Is it all ages, or is it typically a certain age group?
Yeah, we see it in everybody. Used to be a lot more common in females, people that got older in age, usually some people that are overweight or had rapid weight loss, but honestly we see it in everybody today. I see a lot of males, seeing more and more teenagers with gallstones. So yeah, anyone across the spectrum.
And so if someone is watching us right now and they're like, wow, I think I have a lot of those symptoms, where do you work? Who can they call?
Yeah, so Dr. Will Cawthon. I'm with Surgery Clinic of Tupelo. Our number is 662-377-6470.
All right. Well, thank you so much for being with us this afternoon and talking about this important topic.
Thank you.